Are we in the middle of a potential third wave for COVID? Good evening to you. Thank you for joining us. I'm Brian Loftus.
And I'm Denise Valdez. So right now, state health leaders are warning of so-called COVID fatigue. The I-Team's David Charnes has a look at some new data showing a concerning rise in cases and especially hospitalizations. David?
Yeah, Denise, this is just fresh new data. We're going to start with the number of COVID cases here in Clark County. You see 421 per 100,000. That's considered high. It's important to note that the data for these cases is a couple days behind, so none of these numbers include any possible transmission from this weekend's political rallies or early voting. Take a look at this graph, though. This gives us a good idea of where we are in terms of cases. You see that peak there in April, then we have another one there in August. Of course, we had that first and second wave. It looks like, though, a third peak is coming there, and experts say it's a little too soon to say for sure, but this is a little concerning that those numbers are going up. They say, though, we're seeing COVID fatigue set in as more of us become comfortable seeing our friends, our families again. Some of us, though, aren't wearing our masks.
It could be a group of people carpooling, and you had 4 infections as a result of a carpool, or a certain get-together, be it formal or informal, where people felt a level of comfort not to mask or did not honor social distancing. So I again just encourage people to not get COVID fatigue.
She adds that really is important as we head into Halloween, Thanksgiving, Christmas now, just about 2 months away, not putting our guards down just yet. This is another graph just released. It's a 14-day average of deaths. Again, we see that big rise there in July and August, and we're seeing a slow decline. This is good news because it's likely because we're seeing fewer older people get infected with COVID, more younger people. Still not great, but younger people, of course, better able to fight off the disease. And then one more to show you here, if I can get this right and erase this. Here we go. So this is the look at hospitalizations. You see it's pretty flat. We are seeing a little bit of an increase there. That is concerning because it's actually a new high since early September. We're about 500 people now, and again, a new high in the past couple of weeks. So we'll stay on top of this for you. I'm David Charnes, 8 News Now.
All right, on the heels of that report, David, another